Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thank you for joining me on tonight's Egg Whisperer show. The topic is how to talk to your doctor about fertility if you're over 40. Talking about fertility is really hard to do. But when you're over 40, I see so many women apologizing, saying, I'm so sorry, I know I'm so old, but I really want a baby, what do you think? And I want women to stop apologizing. Times have changed. It's okay to want to have a baby if you're over 40. There's nothing greedy about that. There's nothing selfish about it. But I want to educate you about the things that I share with my patients so that hopefully your time to pregnancy will be shorter, especially at a crucial time, which means you're over 40. This headline just keeps circulating over and over again. I'm going to read it to you. Older women exploited by IVF clinics, says fertility watchdog. Older women are being exploited, trading on hope. The fertility watchdog has warned. This headline is not from the US. It was on BBC.com. And I see these types of headlines in other countries, not so much in the United States. But the thing is, are fertility doctors what I would call hope dealers? And the answer is, I don't think so. You know, men can have kids as long as they're still making sperm and they don't have a menopause. But every woman, we know that there comes a point in our life where our eggs are gone. So my approach is to educate my patient about her chances of having a healthy pregnancy at her age, given her levels and her follicle count. Then it's up to her to choose and decide whether moving forward with treatment with her own eggs, if she's over 40, is worthwhile for her. I ask my patients to consider being as aggressive as they feel comfortable being, if of course that makes sense. And then at least they feel like they've given themselves the very best chance for pregnancy using their own eggs, if using a donated egg is acceptable to them. And certainly there's so many other ways to have a baby. There's adoption, there's embryo adoption, there's egg donation, just like I just mentioned. So let's talk a little bit more about this really important topic. It seems like everywhere you look, everyone over 49 is now having a baby. We used to talk about having a baby at 40 as being a big deal. But once Janet Jackson had her baby at 50, people were calling me from all over saying, Dr. Amy, I want you to give me exactly the same treatment that Janet Jackson had. If Janet Jackson can do it, you're such a good doctor. I know you can help me also. Well, I wish I had some sort of superpower. I don't. All I can do is use and work with the DNA that my patient brings me. If you have eggs left, I can certainly do my very best to help you grow an egg. Have I tried to help women at 49 and 50, even 51, have a healthy pregnancy with their own eggs? The answer is yes, because that's part of their process and journey. Have they been successful? The answer is no. Have I had countless women at 49, even 50, deliver healthy babies using other creative options? The answer is yes. And I imagine in 10 years from now, I'm going to have so many women who froze their eggs with me in their late 30s, early 40s, coming back, and I can then say, I have so many women over the age of 46 who have had successful, healthy pregnancies with their own eggs because they froze their eggs when they were younger. Right now, I can't necessarily say that quite yet, but there will come a time as time goes on and I see more patients, I'll be able to say those kinds of things. But I really think that every pregnant is natural. Every pregnancy is precious. Where that egg comes from is really nobody's business but yours. And it's not for you to share. It's not something that you should feel like you should be ashamed of or have to explain or share. That baby is your baby. Like I said, no matter where it comes from. But it's not fair that patients are made to think that these celebrity pregnancies, for example, there was recently one from a host of one of these talk shows during the day. She claimed that she went through, not claimed, I mean, she was talking about how she went through so many IVF cycles and she was over the age of 46. And certainly a fertility doctor knows that usually means using a donated egg. But if she doesn't want to share that, that's okay. But I have to make sure that I educate people that the chance of having a healthy pregnancy without using donated eggs at 47, unless you froze your eggs, is close to 0. I hope one day I can change that number. And the way I can change that number is having some sort of scientific tool or breakthrough that I can use. But for now, all we can do is educate people about egg freezing, getting pregnant younger, and looking out for the signs of DOR. So I'm going to try and be funny here and say WTF is DOR. So DOR stands for decreased ovarian reserve. And you know what? If you're over 40, that's kind of what happens, and it's supposed to happen. It's normal. Our eggs go away, and our healthy eggs go away for most of us when we're 40, and for almost all of us by the time we're 43. So don't be afraid of that term DOR, and I honestly don't like to label my patients. I don't call them things like, you have DOR. I just basically say, I'm going to have this conversation once with you about what your chances are, and then I'm going to be really positive that's what you want me to be. But I'm always going to be transparent about what my expectations are. For example, if I have a 45-year-old patient with one follicle who wants me to take her to retrieval so she can have that experience to say that I actually tried with my own eggs, I'm going to tell her that there's a really good chance that we may not get an egg. And there's a really good chance that if I do, it's not going to be viable enough to even be fertilized by sperm. And if there is an embryo, it probably won't grow. And if it turns out to be a blastocyst, it won't become normal. And for some people, they want to see exactly how that's going to look. And they still want to hope that there's a chance. And my philosophy is, that's okay. As long as I'm not harming someone physically or emotionally, sometimes going through the process is what they need so that they can get to that next step, whatever that next step may be. So here's another thing that's really important to ask a fertility doctor if you're over 40 trying to have a pregnancy. Do I have an option to use my own eggs in your clinic? Doesn't that sound weird? I think it does. But there are fertility centers out there that won't help women over a certain age. A lot of them do a really good job telling you that before you even make your initial appointment. But if, for example, you're 45 years old and you really want a chance with your own eggs, make sure you ask that question first, because there are some centers that will definitely schedule a new patient appointment with you, but they won't treat you unless you're going to use donated eggs or embryos. So if using your own eggs is really important first, then be sure that you're setting an appointment up with a clinic that also sees you in the same way that I do as a fertile person. And then certainly we can definitely talk about all options depending on what we learn about you. Here's another question that I will answer for my patients. But I hear stories of women who are over 40 going to fertility clinics and the doctors will just tell them, there's no chance, you're too old. But no levels have been checked, no ultrasound has been done. So how can you just look at someone and make those blanket statements? You can't. So get your levels checked. Get them checked before you even go to the clinic, so you understand what your levels are saying about you and your fertility chances. But there's one really important thing to realize. Age, when you're over 40, is more predictive of pregnancy success than your fertility levels. So even if you're, let's say, 46 and have amazing hormone levels, and sometimes, I feel like I can see patients who are 46 and I think of them, or I see their levels and I can say things in my head, of course, you have the levels of a 25-year-old. But certainly that doesn't mean that their eggs are the eggs of a 25-year-old and will behave like the eggs of a 25-year-old. So before you even go in, I often ask patients, if they're making an appointment with me, to have their levels checked before they see me so that their first appointment is as efficient as possible, so that we review things realistically in concrete terms, like this is what the FSH over 16 means. This is what it means if it's under 10. This is what an AMH of 0.2 or 0.02 means. So you want to make sure that you get these answers as well and ask, what are the chances based on the levels? It's a very easy question to ask if the doctor isn't already sharing this information with you at that visit. And here's another question that I get. do the chances of twins or triplets go up? And it's not silly to actually ask that, because there are things online that suggest that that can happen. Not so much triplets, but twins. If you look at natural twin rates, they actually are higher in 40-year-olds and women under, I think it's 20. And the reason is when the FSH levels go up, sometimes more than one egg ovulates, and sometimes two are genetically normal and you can get twins. The chances of this happening are certainly low, but it is still a possibility. And can that happen with fertility treatment? The answer is yes. But for the most part, I tell my patients that on average, 1 out of 10 eggs is going to be genetically normal for a woman who's around 40. So the chance that you'll have 2 normal embryos in a batch at 40 is pretty low. But there certainly are people that have that. There are women at 41 that I've seen that have had that. And I've probably seen less than 5 women who have had 2 or more normal embryos in a batch at, let's say, 43. But it can happen. And so the chance of twins or triplets is related to the number of embryos you put in. The chance of having 1 embryo split into 3 is about 1 in 200 million. The chance of 1 embryo splitting into 2 is about 1 in 400 or so. So it does happen. But in general, the number of pregnancies you have is directly related to the number of embryos you put in. So here's another question. And this, I think, is derived a lot from what people read online. And I think it's a really good question. Should I wait 3 months to see if my levels get better? So how would that make things change? How could that possibly help, waiting 3 months? The way I think about it is eggs aren't like sperm cells. They don't necessarily get better over time. However, there are things that potentially can make it better if you're sleeping better, have less stress, have a better work schedule. Those things can certainly make going through treatment not as stressful, and that can't hurt egg quality. But I hear patients say things like, oh, Dr. Amy, I really want to get in shape and I really want to exercise, and then in 3 months my egg quality should be better and then I'll be ready to start treatment. Or I want to do acupuncture for 3 months and my FSH level should get better in 3 months. I wish that was something that actually was true, and I don't see that for women over 40, especially for women over 43. Waiting 3 months will not improve your egg quality. Taking 3 months of, let's say, CoQ10 won't change things, in my humble opinion. So my thing is, remember that you're perfect the way you are right now, unless, of course, you have a chronic medical condition like diabetes that needs treatment, or hypertension that needs management, or cholesterol that needs lowering. So as long as you're a healthy person, you don't have to wait 3 months to be a better you. Your eggs are perfect the way they are right now, and hopefully you'll be able to achieve your goals no matter what your age is. But I want patients to get all the answers they need to make the best treatment decisions for themselves or selves, no matter what your age. So here, when you come to see me, we'll talk. I call it, fertility chatting all day long. I can talk about this. I probably talk in my sleep about this too. I see things online. For example, a woman will say, I'm 37, J-Lo had her twins at 40, I have 3 more years. And that's just not how things work. And certainly it doesn't work this way. This is a question that I get all the time. My friend who's 41 just had a baby. I'm 43, why can't I? All my friends at 40 are having babies. And the thing is that when you're, for example, 33 and your friends at 31 are getting pregnant, there isn't that much of a change in the pregnancy rate between, let's say, 31 and 33. But even within 3 months or 6 months or a year, there's a huge change in the pregnancy rate between a 41-year-old and a 43-year-old. So that difference, that 2-year difference, can be a difference of being able to get pregnant versus having your healthy eggs not be present anymore. So that's why, if you're considering having a pregnancy and you're over 40, get your levels checked, get seen, be as aggressive as you feel that is comfortable for you, and always think about what your options are and see what feels good for you to try and do to have a healthy pregnancy. So I do have some patients that are over 40 that are, with guys that are in their 20s, but oftentimes I have patients in their 40s who are with partners that are 45 or older. So if your partner is also 45, what do you need to know? And so often I find that we just look at patients and we say, you're over 40, you're old, this is why it's not working, and we totally ignore the sperm part. So please don't ignore your full fertility picture, and that includes the sperm component. So, you're going through all of these checks, you're taking all these supplements. You want to see if the semen analysis is normal, the DNA fragmentation is good, if you should be considering supplements for your partner, hormone checks, genetic tests, all the same things we do to the female partner. I'm always thinking about those things for the male partner too. We often tell women, for example, who are over 43, even 40, use an egg donor. But what about sperm donors? Certainly if there are sperm issues, maybe a sperm donor would be better for older eggs, depending on the situation. So that's something to consider and something that I talk to my patients about. And it's easy for a woman, it just seems to just feel like, okay, I guess I have to use an egg donor. And that's not necessarily a cop-out or a bad thing. It's an amazing way to grow your family. But before you do that, think about all the options, because I've certainly seen cases when we choose to use an egg donor and the embryos look the same and are still not viable. And then you say, oh, the sperm probably is the reason why these cycles haven't worked, and you don't want to learn that the hard way. Here's another question. If I froze my eggs at 30, will my age at 45 play a role? And certainly if you're going to your fertility doctor over 40 and you have frozen your eggs, you want to ask this question. And so my answer is, as long as you're healthy and don't have any chronic medical problems, your chances should be just as good, because your chances are related to the health of your eggs. You can be pregnant in menopause. And I use that word menopause because it's normal. It's totally normal to have menopause when you're in your 40s. That's basically when it starts. Some women have it at 40, but in today's times, a lot of women haven't finished building their family before they're done or going through menopause. And so it's like, what can we do about that? All we can do is educate, talk about egg freezing, talk about embryo freezing, and this is why I do this show. There was a really interesting study published at a big meeting. It's called American College of OB/GYN out of Albert Einstein University. And I was saying to myself, I can't believe that people still don't know things about like when they ovulate and when they're the most fertile. One of the statistics showed that a lot of people thought that ovulation happened during their periods. And so that's one of the reasons why I'm doing this show, to teach people about these things that I don't want anyone to feel like you shouldn't ask your doctor about. So ask more questions, talk about these things, talk to your partner, and like I always say, get your levels checked. And then how do you know if you need a gestational carrier? I'll tell you what my approach is. I talk to all my patients over 45 about using a gestational carrier, and all my patients over the age of 51. And the reason is I want my patients to be really healthy for their future family and be really strong and not have any pregnancy complications. It would be ridiculous for me to make it seem like pregnancy over 40 was easy, and even pregnancy over 50. It isn't easy, and it's hard to recover from pregnancy. It's harder when you're over 40 and 50. And so I have this conversation with my patients just so that they know what to expect, what will happen to their body during the pregnancy, and what the postpartum period is like. So they feel like they have an option to use a gestational carrier if they want to. Do you have to? No. But there are some clinics that have limits on age. And so you want to ask that question. Does this clinic have a limit on age? And how old is that? What is that age? Is it 50? Are you 49 trying for a pregnancy, and then you're going to be 50 in 2 months, and they're going to tell you that you have to use a gestational carrier at that time? So those are the things that you want to know going into it. And then here's this question. What are the signs that you are menopausal? Let's talk about it. Because again, it's normal. And so if your cycles are getting shorter, for example, they were 28 days and now they're every 15 days, and then they start going to every 40 days or so, then you know that you're in that transition. We call it the perimenopausal stage. So at that point, it becomes really hard to track your ovulation and really hard to get pregnant, because your eggs are showing that that you're ovulating earlier, so the egg quality is going to be lower. And then when your cycles are spaced apart, it just means that you're ovulating much later, and then eventually the ovulations stop. And then your FSH level will go to 40, and then you're going to have no periods for a really long time until you don't have any periods at all. And you're often going to feel like you're going menopausal, almost like you're going postal. I can tell you, I'm feeling that myself. You have these wild swings in your hormones, and it's really not that much fun. And there's certainly ways that you can manage it. But telling someone who's having these hormone swings in irregular cycles when they want to get pregnant that they should take birth control pills is, kind of mean. Because if you still want a chance for pregnancy, obviously that's not going to be helpful. But seeing a doctor who can teach you about what your levels mean, what they mean for you, what your pregnancy chances are, so that you can have a threshold at which time you stop treatment and start talking about other options is my approach. So even if you don't have a doctor with that approach, you can take this approach to them and say things like, hey, how about for the next 6 months or so, let's try fertility drugs. Let's see if I can ovulate more than one egg and see if I can get pregnant. And then if not, then I'm totally open to considering other options. But for now, I still want to have hope and believe that I can get pregnant with my own eggs. This is another really important question to ask, and I know I've already talked about this already on the show. Based on my fertility levels, what are my chances of having a healthy pregnancy, and have you ever had a patient do so? I have never had a patient get pregnant with a healthy pregnancy using their own eggs at 47. I have at 45, I have at 46, and obviously under 45. So that's a question to ask your doctor, and it doesn't mean that they're not a good doctor if they say, no, I haven't had a patient get pregnant with their own eggs at 44. It doesn't, because it's so rare and it's not very common, but it just will allow you to understand what your real chances are. So if, let's say, they've been in practice for 20 years and they've had 3 patients getting pregnant with their own eggs at 44, you want to ask them, are my fertility indicators similar to those patients that you treated? Yes or no? And what would you do if you were me? I have patients that say that all the time. They say, oh, I know you can't tell me what you would do if you were me. And I say, why can't I tell you what I would do if I was you? I know a lot about this stuff, and I definitely want to guide you in the most compassionate way, as if you were my sister, as if you were my daughter. I want to teach you everything that I know about this stuff, and then allow you to make a decision that feels right for you. So that's how I approach things, and I hope you get that same compassionate care. And I also don't want women over 40 to ignore the other fertility factors that could be playing a role. And you hear me saying this all the time: get your tushy checked, get your tubes checked, get an ultrasound, get the sperm health checked, get a full hormone panel done, and look at your carrier screen. Because if we're just focused on age, I can tell you, when you're ready to use a donated egg and you find out that you have a big fibroid sitting in the middle of your uterus and now you have to wait another 6 months to have a pregnancy, that's really frustrating. Or you find out that, same thing, you're ready for a donor egg pregnancy and then the sperm's not viable. Again, that's really frustrating. So I want you to get your diagnosis before treatment and don't just focus on one thing. For example, if you've been told that you're over 40 and all your miscarriages are due to your age, well, I still think it's worthwhile to look at everything and not just focus on your age as being the reason why. What if it's a chromosome issue in you and your partner? It would be frustrating to miss an opportunity to do something different if you found that that was the case. So thank you guys for watching tonight's show. I just came up with a short checklist. There's just 3 things on it. If you're over 40 and you want to talk to a fertility doctor, these are the 3 things I want you to do. Number 1, I know I sound like a broken record. Get your levels checked and repeat them if it doesn't seem like they make sense. So for example, if your AMH is 0.01 and your FSH is 5 and your estradiol is 30, maybe repeat your AMH. Repeat your FSH and estradiol with your next cycle. Get the full picture and track these levels. That's my approach. Go in with your levels to that first visit so that your time spent with that fertility doctor is very efficient and you can strategize and come up with a plan and a calendar if needed. Number 2, don't forget about your tushy. Don't do it. Don't ignore all the other possible fertility factors that could be contributing to the reason why you're not getting pregnant naturally if you're over 40. Number 3, don't be afraid if signs are there that you're close to menopause. You can have a pregnancy in menopause. And the reason? Hormones. We use drugs to mimic ovulation when we help people get pregnant. And it doesn't matter if you're 49 or 50 or 51. I mean, you hear about people carrying pregnancies even older, 53, 60, 63. And they aren't using their own eggs, and we're not relying on their ovulation. So again, don't be afraid. These things are normal. It's just part of life. It's just a matter of figuring out where you are, what your levels are saying about you, and what you want to do next. And if you're ready for a donated egg, great, go for it. If you're not, it's okay to wait. And like I said, try for a few months, revisit, regroup, look at your levels, talk to friends, family, support groups, a therapist, and then see what feels right for you. So I hope this show was extremely helpful for you guys tonight. I hope these tips and the questions that I brought up are things that you'll feel comfortable talking to your fertility doctor about if you're someone who's over 40, planning and trying for a pregnancy. And I wish everyone the best of luck. And no matter who you are or where you live, I really hope that you're going to be wildly successful in everything that you choose to do in this life. You guys have a great night, and I look forward to seeing you next week. Good night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.